HealthBreak is sponsored by Dignity Health Central Coast.
An estimated 15 million babies are born preterm, which is before 37 completed weeks of gestation, and the number is rising. Dr. Danielle Feldman at the Perinatal Obstetrics and Gynecology Health Center explains the complications of preterm births.
Prematurity is associated with many risks both in the short term and in the long term. So premature babies, depending on how early they're born, can have an increased risk for many health complications. Also developmental issues can come up, and so it's certainly something that we try to reduce the risk of.
The most common risk factor for having a preterm birth is having had one in the past. Fortunately, seeking care from a maternal fetal medicine specialist early can help.
When they come in for an anatomic survey, usually that happens around 20 weeks. The goal of that ultrasound is to look at the baby's anatomy and body parts, but we also look carefully at the woman's cervix to make sure that it's long and normal appearing. For anything that looks abnormal, depending on what the appearance is, that might be a flag that the risk for that particular patient is increased, and we would want to follow that woman more carefully and sometimes offer interventions. The most important thing is to seek prenatal care early, to determine with your provider what your risks are and what level of intervention you need.
For more information, visit dignityhealth.org/Central Coast.
HealthBreak was sponsored by Dignity Health Central Coast.